In this video, we're talking about a very common condition in older cats, an overactive thyroid. It is otherwise known as hyperthyroidism. This is a very common disease in cats, and happily it is also very treatable. And it is one of the few chronic diseases of older cats for which there is a cure. We're going to talk about that in a few minutes. The disease occurs when the thyroid gland produces too much of its hormone. The thyroid gland is a small gland located in the neck, just about here. Its job is to produce thyroid hormone, which is really important for normal body function and for growth. In some cats, the thyroid gland produces too much of this hormone later in their lives. We don't quite know why this happens. It may be partially genetic, possibly environmental, but it really only happens in cats above 9 years of age, although very infrequently it can occur in younger cats, and the youngest that I have seen has been 7 years of age. When the thyroid gland produces too much of its hormone, you will get the clinical signs of hyperthyroidism. These signs are usually weight loss with an increased appetite. Sometimes you may see that your cat is drinking more, and some cats may have a poor coat. You may also see vomiting or diarrhea. None of these signs are at all specific for hyperthyroidism, and some or all of them you may see with kidney disease or diabetes or gastrointestinal disease. But if you see these signs, you should take your cat to the vet, as they may indicate that something is wrong. The condition is easily diagnosed with a blood test by your vet. The blood test checks the levels of thyroid hormone that your cat has, and in cats with an overactive thyroid, that level will be high. One test is usually enough to confirm the condition, but occasionally an additional blood test may be required, especially if your cat is in the early stage of the disease. Once your cat has been diagnosed with an overactive thyroid, it is a condition for life, but it can be very well managed, and it should not affect your cat's overall quality of life, and it should not decrease their lifespan. But this is only true as long as it is diagnosed relatively early. If undiagnosed or untreated for a long period of time, having an overactive thyroid can negatively impact your cat's heart, and ultimately it can result in heart failure. And if you would like more information about this, please watch the video that I have made about heart disease in cats. This is why it is so important to take your cat to the vet if you notice any of the signs that I mentioned. The sooner the condition is treated, the better it is for your cat. Let's talk about the treatment options for cats with an overactive thyroid. The best treatment for your cat will depend on their age, their lifestyle, and your ability to medicate your cat. The first treatment option is medication. There are several medications that can be used, including a tablet, a liquid that goes into your cat's mouth or into your cat's food, and there is also a cream that can be applied to the skin of the inner ear. All medications block the thyroid gland from making its hormone. Medications need to be given once or twice daily for the rest of your cat's life. If you opt for medication, you should carefully consider the ongoing costs. Medication will be for life, so you need to make sure that it is something that you can continue to do for the rest of your cat's life. The next treatment option is surgery. Surgery can be performed to remove either part or all of the thyroid gland. Both surgical options have pros and cons, and you can discuss these with your vet. Some cats who have surgery require medication for an overactive thyroid again later in life, so it is not considered a cure, but it can buy your cat some time where medication is not required. For this reason, surgery is generally not the best option for a young cat, but for an older cat it can be a good option, particularly if you cannot medicate your cat. The third treatment option is food. Iodine is required by the thyroid gland to make thyroid hormone. So feeding your cat a diet that has no iodine in it will stop the thyroid gland from overproducing its hormone. This is a good option for indoor-only cats who have no access to any other foods, and it is also an option for cats who are not fussy with their food. But in my experience, this can be problematic, as most cats tend to be fussy about food and they like variety. There is only one suitable food on the market. It is made by Hills and it is called YD. YD comes in both wet and dry versions. If you choose to treat your cat's hyperthyroidism this way, your cat would need to eat only this food for life and nothing else, which is why most owners do not choose this treatment option. Earlier, I promised you a cure for cats with an overactive thyroid, and that is what we're going to discuss as the final treatment option. Hyperthyroid cats can be given an injection of radioactive iodine, which is then taken up by the thyroid tissue, which is causing their disease. Taking up this radioactive iodine causes the abnormal tissue to be destroyed. Radioiodine treatment is a safe and effective way of treating an overactive thyroid, and usually the results are permanent for about 95% of cats treated, which means that it cures the condition for these cats. This treatment has to be given at a specialised centre, similar to a cattery, because your cat will be just a little bit radioactive for a short period of time, but it will not harm them. Cats usually need to stay at the centre for about 1 to 3 weeks before they are allowed to come home. That is the most important information that you need to know about one of the most commonly diagnosed diseases of older cats. If your cat is diagnosed with this disease, please do not despair. It is a very treatable condition, and most cats will live a normal lifespan with this disease, especially if it is diagnosed early. I have more resources on my website, and if you have topics that you would like to see a video on, please let me know and I will be happy to make one for you. See you in the next video.